Hi, I'm Austin. I'm going to be your nurse today. Can you tell me your name?
Seth Leatherwood,
Okay, how old are you?
21.
Alright. Today we're going to perform a respiratory assessment on you. It's a little in depth. I will be doing some touching, some tapping, and I will be listening to your lungs in several different spots. It kind of takes a little bit, but we're going to be checking for any type of abnormalities or anything like that, okay? Alright. First thing we're going to check, I'm going to check the shape and the contour, configuration and contour of your chest, okay? Make sure that both the interior and the posterior and transverse, symmetrical, and his AMP is 2 to 1, yes? Alright, so I'm going to go ahead and I'm going to start with the posterior assessment. So I'm going to need you to swivel around if that's okay. All the way around just like that. Good. First thing I'll be checking for is tenderness, okay? So let me know if you feel any type of pain here. Any?
No.
Here?
No.
Here?
No.
And here?
No.
All right, perfect. Next thing we're gonna do is we're gonna move on to tactile phrenitis, okay? So I'm gonna place my hand over several spots on your back, and I'm gonna be listening for vibrations, okay? Every time I move to a new spot, I need you to take a breath and repeat the words 99, all right? All right, so we're gonna start here.
99.
Good.
99. 99. 99. 99. 99. 99. 99.
Perfect. Now I'm gonna go and check for symmetrical expansion, so just breathe regularly. Good. You can breathe normal. Chest rise from this posterior side is symmetrical. And expansion wise. Now I'm gonna go ahead and move on to what's called percussion, where I'm gonna be doing some tapping and listening. So every time I tap, take a deep breath for me, okay? I'm gonna start just like I did a minute ago. Here though. Go ahead. Good. Last time. Perfect, okay? Now I'm gonna go ahead and take a listen. Every time you feel the move in my stethoscope, I want you to take a deep breath, okay? If you start to feel winded or dizzy or lightheaded, let me know and we'll stop. And then we'll restart once you get your head, okay?
Okay.
Perfect. Now I'm just checking. So straight up for me, perfect. I'm gonna check your spinal alignment all the way down, straight, and your scapulars are symmetrical. Perfect. Now we're gonna go ahead and do the same thing at the front. If you'll turn around. All right, we're gonna do the same thing I did over there. So let me know if you have any tendon on the back. Let me know if you have any tendons at all. Okay.
Okay.
Any here?
No.
Here?
No.
What about here?
No.
All right. You can breathe normally. Chest is symmetrical. Respirations are even and unlabored. Next thing we're going to go do is same thing on the back. I'm going to do what's called tactile fremitus, and I'll be just listening for the vibrations as you breathe. Okay. So remember that phrase 99. We're going to do that again. Okay. All right.
99. 99. 99. 99. 99. 99. 99. 99. 89.
Perfect. Now I'm going to go ahead and do the same thing again, just like we did on the back. I'm going to do the tapping again, okay? You doing okay? Perfect. One last time. Perfect. Okay. Now, the last thing I have to do, I have to listen to all the lobes of your lung from the front side, okay? And just like before, every time you feel my stethoscope, deep breath in and out. And move on to the next one, we'll repeat, okay? All right, last time. All right, perfect. And this completes our assessment of your respiratory system. Do you have any questions for me? All right, let's complete that. Post-assessment follow-up on Seth, a 21-year-old male who came in for a complete respiratory assessment and assessment of his anterior and posterior chest. His posture was upright and good. No evidence of rounding was noted. His shape and configuration of his chest was within normal limits, symmetrical. His AP to T diameter was 2:1. His posterior chest was negative for tenderness. Tactile fremitus was positive for vibration and resonance, as well as equal expansion of his entire posterior lobes. Percussion was resonant for vibrations, and his lung fields were clear in all lobes. Moving on to his anterior chest, his respirations were equal and unlabored. No use of accessory muscles. Respiration rate was at 17. He was also negative for tenderness on the anterior side. Tactile fremitus was positive for vibrations and within normal limits. His lung fields on the anterior side of his chest were clear, and These patient denied any form of respiratory ailments, no history of asthma or shortness of breath prior to arrival in any form or fashion.